Hi, I'm Dr. Anurag Gupta, Senior Neurosurgeon at Narayana Super Specialty Hospital, Gurgaon. 26th March is celebrated as World Epilepsy Awareness Day. Now, epilepsy is supposed to affect approximately 1 in 25 people in our population. That's like nearly 4% of our population will have epilepsy at some point of our life. But unfortunately, in our country, epilepsy has a lot of stigma and misconception attached with it. And I think partially because of the way it has been shown in our movies and in our media. Now, epilepsy is basically a person who has multiple seizures is called to have epilepsy, and it happens due to a electrical short circuit in the brain. Some people may be suffering because of either tumors or after a head injury or bleeding, but in majority of patients, there is nothing wrong when they get an MRI or an EEG done and just suffer with seizures. But fortunately, most people can be very well controlled with a single medication as long as they take the medication on time as told by the doctors. Most people can go about have a normal life, do the normal activities, and you can't even make out that they're suffering from epilepsy. It's almost like somebody is suffering from hypertension or diabetes. As long they're regular with their medication, they're good to go, they're fine. But unfortunately, in India, people associate epilepsy with a lot of misconceptions, like it's a communicable disease, or if somebody has epilepsy, if I do something, I may get it, or if somebody has epilepsy, the children may get it, and you see a lot of misconceptions. But no, it's not a. It's most of the conditions are not hereditary. There is no guarantee that if you have it, your children or somebody else will have it. You cannot get epilepsy by touching somebody or being with somebody who's having seizures right now. Epilepsy should be treated like a normal, your usual, like any other disease. A person suffering from epilepsy should take a consultation and treatment at the earliest and should follow the doctor's advice, take the medication on time, and they will have a normal life after that. So now what to do if you see somebody is having a seizure, or if you have somebody in your family or in your neighborhood who's known to have seizures. Now seizures look scary. Uh, they're very dramatic. The most common type of seizure is when the person is shaking all of his limbs, the hands, limbs are shaking, eyes may be going up, face may be tight like this, and it's a very scary sight. But we have to remember that most seizures will stop on their own within a minute or 2 minutes, and we do more harm by trying to stop the seizure, or what we have seen in various movies that try to put something in his mouth or try to maybe make him smell a chappal or something. But the thing to be done when somebody is having a seizure is to take them away from a dangerous condition. If they are standing, make them lie on the bed or lie on the floor. Turn them to one side, either the left or right, anything is fine. This is done to, if they vomit or they bite their tongue, whatever blood or thing doesn't go choke them but comes out of their mouth so they can still keep breathing. Don't try to put anything in their mouth or try to open their mouth, because the force of contracture is so strong they can bite off your finger or break something else. And if you see, most of the people will go through the seizure within a minute or so, and then they will recover after that. The time to panic is when, if somebody's seizures don't stop, if they keep on happening for over 5 or 10 minutes, or somebody does not regain consciousness between those episodes of seizures. Somebody who has seizures has a different sort of seizure, which is different from what they had in the past, or somebody's having a difficult, they fall down, or they hit themselves, or they hurt themselves. That's the time when they have to be taken to a hospital where they may require further medication to control their seizures. So let us remember on this World Epilepsy Awareness Day that epilepsy is nothing to be scared about, is nothing to be feared about, and it should be treated and managed like any other disease, like how we treat a person with maybe hypertension or diabetes. And a person who takes his medication and treatment regularly can go about his normal life.